True. Anyway, let's go to our first guest,
Great.
who is on the phone and are ready to talk to us. I hope. Anyway, we'll find out on the air. Good morning. You're on KSJE. Thanks for calling in this morning.
Hey, good morning, Scott and Megan. This is Jeff Bourgeois. How are you all today?
We are
Great,
good, Jeff. Thank you for calling in. Jeff Bourgeois, of course, CEO of Salmon Regional Medical Center, with our live update today. And so we've been looking at the numbers, Jeff Bourgeois, and it seems like things are maybe coming down a little bit. I don't want to jinx it or try to say something that's not true.
We're not going to
but
be superstitious here.
No, not at all. But what do things look like for you at the hospital?
You know, our respiratory census is very high. We have a total of 54 positive patients and another 12 additional respiratory patients, and a total of 6 of those are, 6 COVID patients are intubated and a total of 10 intubated patients. So pretty heavy respiratory census for us right now.
And that is that the highest that you've seen, Jeff Bourgeois, in several weeks, or since spring, or the highest since this whole thing started?
Yeah. You know, I don't know if it's the highest since this whole thing started, but that 54 positive patients is right up there with as high as we were back in April, May. And then the other seasonal respiratory illness is adding to that respiratory count. So it's as busy as we've ever been, essentially, with the combined COVID and other respiratory diagnoses.
Understood. And of course, we've talked a lot about the treatments and things like that. So, I mean, case numbers are higher now than they were back in the spring. And so I would assume that because you're not totally overwhelmed, it's because people are being able to be treated maybe at home. And we've talked a lot about your COVID to home program there at Salmon Regional Medical Center. And so not everyone, obviously, who is COVID positive needs to come to the hospital or needs to be in the hospital for several days at a time, which is a good thing.
That's right. However, with this second surge and the number of new cases being diagnosed daily, even with the lower hospitalization rate, we are seeing, as I mentioned, pretty heavy inpatient census. Our COVID to home program, in a period of 3 weeks earlier this month, went from a census of 9 to 50. And what we noticed was that those patients later in the month were sicker than they were earlier in the month, if that makes sense. So kind of from low to moderate illness to more moderate high risk, that we were really monitoring their symptoms and working with them, touching base with them twice a day to see if they were okay to stay at home or if they needed to come to the hospital. Overall, there's over 900 hospitalizations in the state today. We never got over 300 statewide back in the first wave. So that gives you a measure of how much more activity there is around hospitalizations in the second wave.
Indeed. Thank you, Jeff.
Yeah, that's pretty scary. So keeping the spirit of that, are we having a lot of shuffling around? Are we sending people to Albuquerque? Are we taking people from Albuquerque or any of the other neighboring areas yet?
Let me look at something, Megan, so I can speak, because I have that report. Just to look at last week's transfers, we had 23 transfers in and 16 transfers out. The transfers in, 2, 3, 4, 5, 9, 10. 10 of the 23 in were COVID positive, so 13 were not. And they typically came from our normal regional transfer patterns. 8 of those 23 came from Northern Navajo Medical Center, and then from the other Indian health services around us, Gallup, Kayenta, Red Mesa, Dulce, Crown Point, and Chinle. We typically receive patients from those hospitals pre-COVID, and so that's continued. The transfers out were mainly for services not available here. Some behavioral health transfers, as well as some children's hospital transfer, and then some other higher level of care. But back to your question, Megan, we had no transfers in from really outside of the Four Corners area. So we are part of a statewide hub and spoke model, as we talked about before, and we work through their central command center to both move patients in and out, particularly those that need an ICU level of care.
Gotcha. And let's talk about visitor policies again, because we haven't touched on that in quite a while. And then now there's this surge, and now it's the holidays, and there's so many contributing factors to this visitors policy. What is the most recent visitor policy?
Well, it's available on our website. It's really challenging for everyone. I can tell you our caregivers really appreciate the ability of family members to be there and support their hospitalized family member, and having to put restrictions on that is really just not anything anyone appreciates. And similarly, from the family's point of view, they want to visit their loved one. But that said, for our inpatients, there are no visitors allowed except for a handful of circumstances. The pediatric patients, the expectant mother, patients that lack decision-making capability, or end-of-life circumstances, and then clergy. We do allow clergy, and particularly for end-of-life circumstances. And then in the emergency department, we're really trying to manage that in a way that we've got the ER split into a respiratory and non-respiratory side, if you will. And on the non-respiratory side, we're working hard to allow visitors, again, for pediatric patients, as well as patients who can't care for themselves, although while they might still have decision-making capability, let's say if they have a broken hip or something and are otherwise unable to mobilize for themselves, on a case-by-case basis, working with the physician and the direct patient care nurse there, they'll consider allowing a visitor in, again, only on the non-respiratory side.
Great. And before we wrap up, Jeff, is there anything else that you would like to share with us?
Well, just encourage everyone to be patient with all of these changes we've had to put in place. The vaccine is just around the corner. We're still coordinating with the state on when and how deliveries will be made, and then how the doses will be allocated on a statewide basis. But generally, it'll follow what you hear in the national press around caregivers and high-risk individuals getting the vaccines first. But we don't have any definitive timelines or anything around that.
Very good. Well, as always, Jeff, and the rest of your staff at the hospital, thank you so much for keeping us safe and for letting us borrow your time.
Well, it's my pleasure. Glad to talk with you guys. I'm happy to do it. And thank you all for your support of our caregivers here. This has been a once-in-a-lifetime event for all of us, we hope. And I'm proud of the work we're doing here.
We appreciate it, all the work that all of you are doing. So thank you, Jeff, very much. Jeff Bourgeois, the President and CEO of Salmon Regional Medical Center, joining us here on KSJE on our COVID information program on this Monday morning.